You know the routine when you have the flu. Your life fades into that suffering world of high fevers, body aches, and overall misery.
Why'd you get the flu shot this year?
Well, I wanted to be a little proactive this year so I could, not get the flu this season. Last year I got sick and it wasn't fun.
Virginia Health Commissioner Dr. Karen Remley, a pediatrician, recommends the shot as basic prevention.
Because flu is one of the leading causes of death for people in our country. Over 36,000 people die every year in our country, and it's preventable by getting the flu shot.
But critics say flu death figures are misleading. The government has failed to prove the 36,000 deaths are from not getting the shot. In fact, a review of studies suggests the shot is quite ineffective in young children and the elderly. And the shot changes every year and is only a guess about what influenza will actually be going around. Barbara Lowe Fisher, head of the private National Vaccine Information Center, believes the government uses flu death figures to scare people into getting the shot. But she says people are smart enough to decide for themselves which vaccines to get.
If we allow vaccines to be subject to the test of the marketplace, then the public will use those vaccines that they consider to be safe, effective, and necessary.
Older people have long been considered more susceptible to the flu and its consequences. Today, a full 65% of American seniors get the flu shot. Back in 1980, only 15% were vaccinated. Deaths attributed to the flu should have gone down as a result, but they have not. Flu shot critics also say the vaccine is not foolproof. Even people who get the shot may get the flu anyway. An American Medical Association study found that 3% of unvaccinated adults got the flu. But a full 2% of those who did get the vaccine also came down with influenza. That means that only one case of the flu was prevented for every 100 shots given. And some say that the dangers of the shot outweigh its possible benefits. They worry about long-term side effects, such as chronic joint pain, increased allergies, and a greater risk for Alzheimer's disease. Some moms, like Heather Mora, have read up on the flu shot and are resisting the trend to vaccinate children as young as 6 months old.
The flu vaccine could compromise her immune system. In addition, I'm not interested in having her exposed to the various toxins in the flu vaccine.
Fisher believes the flu shot is one vaccine too many for children.
In 1982, the government said all children should get 23 doses of 7 vaccines by age 6. Today, with the addition of influenza vaccine to those recommendations, our children are being asked to get 69 doses of 16 vaccines from birth to age 18.
Fisher says with that tripling of shots, there has come an increase in long-term disability.
A tripling of the numbers of children who are suffering with learning disabilities, ADHD, asthma, autism, diabetes, rheumatoid arthritis, inflammatory bowel disease.
Those afflictions are why Fisher opposes a New Jersey law forcing kids in daycare and preschool to get the shot. She says parents should have the right to obey the dictates of conscience.
Or to pray for guidance and obey the guidance you're given. We cannot be forced by our government to inject our children with any kind of biological or give our children a pharmaceutical product that could injure or kill that child without our voluntary informed consent.
With medical and public policy concerns, doctors like John Cannell say there's a better and more natural way to prevent all kinds of winter illnesses, including the flu. He thinks both adults and children can prevent the flu by getting enough vitamin D. He believes the reason we even have a flu season is because our vitamin D levels drop as we get less and less sun with the approach of winter.
Pretty much any disease, any infectious disease that's more common in the wintertime is a target of vitamin D. Even some of the more prolonged infections, such as tuberculosis.
Cannell says vitamin D triggers your body to produce its own antibiotics against the flu and colds. So he suggests babies get 1,000 units a day and older children get around 2,000 units. With liquid D, that means only a drop or 2. Public health officials suggest asking your doctor about the flu shot decision and about vitamin D so that you can make an informed decision about what's best for you and your family. Galen Tethrow, CBN News.